It's not uncommon to be concerned with one's appearance. We all want to look our best. But as Rod Starn shows us in our cover story, when that concern starts to interfere with daily activities, it could be a sign of something serious.
To many teens, image is everything. The right clothes, the right hair, the right look. Unfortunately, for millions of American youth, this concern can develop into an eating disorder. Ann Anderson knows all too well how quickly things can spiral out of control when dealing with the illness. Ann struggled with self-esteem issues through her college years, but it wasn't long before those issues took over.
I got out of a serious relationship a couple years ago, and I was really upset about it ending. And I thought part of it might have had to do with my body image. And so after that, I turned all my attention to health, what I thought was healthy at the time. I became obsessed with working out and eating right, and the weight just kept falling off. It happened really slowly at first, and no one noticed. I was losing a couple of pounds a week, and this went on for months and months. I started around 103 pounds, and when I got down in the 90s, I couldn't believe it. And then when I got down in the 80s, I was just shocked. And then when the 70s came up, I was like, okay, this is serious. And I finally stopped, being in denial and said, I need to put some weight back on. I'm ready for treatment. I'm ready for help. I'll do whatever I got to do to turn this around because I do want to live.
Hey! How are you?
Good, how are you?
Good. Good to see you.
Ann sought professional counseling and soon realized her self-esteem issues were a sign of an eating disorder, anorexia nervosa.
Anorexia nervosa is an eating disorder where there's excessive fear of weight gain, excessive weight loss. There are some obsessive control issues with those who suffer with anorexia nervosa.
In addressing the problem, Ann was able to put a stop to her weight loss behavior. But her obsessive impulses triggered a second eating disorder, binge eating.
It has to do a lot with emotions, emotional overeating, or eating as a reward, or eating as a control. And there's no purging with binge eating.
Getting back to a healthy weight solved the physical problem, but not the emotional one. Ann now saw herself as overweight, and that brought on a third eating disorder, bulimia.
Bulimia is categorized by binging and purging. Binging is eating an amount of food that's larger than your average amount within a 2-hour period. And the purging can be anywhere from self-induced vomiting to laxative abuse, diuretics, or excessive exercise.
People close to Ann know she's now in a healthy weight range. So it's often difficult to understand why someone with an eating disorder can see an overweight person looking back at them in the mirror. That's because for those patients, another illness is often part of the equation.
There is a disorder called body dysmorphic disorder, and that is where there is such a distortion from reality to what they see. And reality would be Ann is doing really well for herself. She's doing very well in her body weight. What she sees in the mirror is very distorted.
Dealing with an eating disorder and helping someone through the process require a lot of effort and patience. Both critical factors because the life of the patient could be at stake. That's why it's so important for friends and family to recognize the signs and symptoms of any of the 3 eating disorders.
Hoarding food, excessive exercise, being upset when exercise, the routine is kind of thrown off course. There is going to the bathroom immediately after eating, talking about food to the excessive, cooking food and loving cookbooks but never partaking in eating. So there's a fear of gaining weight. There's a distorted body image as well that goes along with that. And there's just an overall emphasis on figure, weight, and food.
For parents recognizing those symptoms, having an open, honest line of communication with a child and giving support can go a long way in treating the disorder.
You tread upon it lightly. A lot of times parents want to just jump right in and control it because they feel so out of control if they didn't know that their child is suffering and that they want to get their child help. So not nagging, knowing that this is an illness and that it does need to be treated. 85% of adolescents who are treated at the beginning of their eating disorder actually have full recovery. So that's exciting to think about. There is a possibility for them to fully recover.
I didn't realize truly how many positive things have happened this past week and a half.
Ann is excited about the progress she's making since starting her sessions with Catherine.
We talk about body image, we talk about, trigger foods, we talk about my family, emotions, things I've been dealing with, how I approach situations. And then also I see a dietitian. We talk about menu planning, how to incorporate foods that I'm uncomfortable with, how to eat a healthy portion. And then also I work with a personal trainer who helps me learn a healthy way to exercise. Because normally I think the more the better, and I will literally exercise for hours and hours and still want to do more. So she's teaching me how to exercise in a short amount of time but make it intense enough to where I'm satisfied and feel like I've done something.
I think she's doing great. I'm really proud of her. She has had such an awareness over the time that we've been seeing each other. I've seen her grow into an awareness of understanding herself, understanding how this disorder is manifested in her life, and the steps that she needs to take to overcome this.
Really, this is an inside job. Everything that's going to help with this has to come from within me. I have to do a complete change of my mindset. I have to learn to like myself, and not only that, but love myself. I have to learn to be confident again and learn how to be comfortable in my skin and know that I'm just another person out there in the world, and that I don't have to have food and exercise rule my life, that I can have a normal life. I think for the first time in a long time, I'm feeling hopeful.
For Smart Medicine, I'm Rod Starnes.